Okay, this is part 6 of Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. We're on page 39 for anybody following along in the book. This is chapter 2, Hypertension, the Gateway Disease number 1. So what this is all about is in the Western world, pretty much all the patients have the same disease, okay? They're all hypertensive. Most of them are pre-diabetic or diabetic. Hypertension and diabetes filter into the same problem of causing atherosclerosis. They plug up arteries in the heart, coronary artery disease, heart attack, angina, atrial fibrillation, congestive heart failure. They plug up arteries in the brain, cognitive decline, and then they plug up arteries everywhere else. They start going blind, cataracts, glaucoma, diabetic retinopathy, hypertensive retinopathy, age-related macular degeneration, etc. Now, if you read conventional medical books, I want to say this, and I want to make sure this is clear and not ambiguous. The textbooks written by the most famous medical centers and the Ivy League, they stink, okay? I just tell you that when I was in surgical internship, I had a very funny senior resident, and if ever one of the junior residents did something stupid, he would say, "Where did you go to medical school?" And then they would tell him, and he goes, "I wouldn't wipe my ass with that diploma." And so I'm joking, but the reason why I tell you that is because it is not a joke. The textbooks written by the Ivy Leagues, they're pathetic. They're an embarrassment. They're a disgrace. Okay? This is what it'll say in the most recent textbooks. These are what medical students are still being taught. Conventional medicine says 90 to 95% of hypertension, very often 95%. Is idiopathic, of unknown cause, and they refer to it as essential hypertension. Idiopathic, of course, means the doctor is an idiot and the patient is pathetic. This is the same nonsense that was taught to me over 35 years ago when I was a medical student. Conventional medicine says that hypertension is a chronic disease and there is no cure for it. Okay? Conventional medicine says pretty much the same thing about almost all the chronic diseases. Well, it's associated with aging, it's partly genetic, sometimes it's due to socioeconomic disparity. We all know how terrible racism is. And sometimes maybe it's due to a virus. And you're like, oh, isn't that thoughtful? Isn't that wise? No, it's a bunch of horse shit. It's completely untrue. It's a freaking lie. Yeah, it's associated with aging. But other than that, it's a complete lie. You go to Africa with these poor people back in 1929 where they ate a plant-based diet, there was zero hypertension. I'll show you the actual papers, just so you know. Conventional medicine is a lie and a disgrace, okay? So, yeah, their theory is match the ill to the pill and send the bill. Just take our pill and slow it down. It's all a crock of BS, all right? And I can just tell you a couple things. Walter Kempner back in the 1940s and 50s was getting great results, you know, getting people's systolics from the 200s down to the 130s and stuff. And he did it just with diet, okay? He fed them, you know, the rice diet with some fruits, multivitamin. Nathan Pritikin and John McDougall were able to get 90% of hypertension patients off their meds in a week or less. People with more chronic hypertension, it's going to take longer to get it down because they got calcified arteries. They've lost their Windkessel effect, the elastic fibers in their ascending thoracic aorta. Okay? These old-fashioned populations eating plant-based diets, they didn't get any hypertension. They'd have the same blood pressure when they're old as they did when they were teenagers. Okay, so here's a classic paper. Blood Pressure in the African Native by Donison, C.P. Donison from 1929, Lancet Journal. And they had 1,800 consecutive admissions. These were all men who were admitted to the hospital. These are black men in Kenya admitted to hospital. In the United States, if you check the blood pressures of 1,800 adult black men, probably about 80% of them will be hypertensive. Okay? In Kenya, zero. No one was hypertensive. So all this stuff about blacks being so genetically prone to hypertension, it's all bullshit, okay? The reason why blacks have so much hypertension in the United States is because they eat hardly any potassium because they eat so much processed food and fast food and junk food, okay? There's the answer. It's not racism. It's not socioeconomic disparity. It's because they eat a crappy diet, okay? And they found that, you know, the whites were eating more sodium than the blacks, but it was counteracted because they were eating more potassium, which means when you say potassium, you should think that's like saying plant foods. P for plant, P for potassium. And you get it from whole intact foods, because when you process a food, you smush it down, you grind it, and then the potassium is an intracellular ion. Then they rinse it with water and solvents. They rinse away all the potassium when you make processed food. Then they throw a bunch of salt on it, sodium, to make it more flavored and as a preservative. So processed food inherently, virtually always, high in sodium, low in potassium, also low in magnesium. Magnesium is also an intracellular ion. Whole foods, by their nature, they're virtually always high in potassium and magnesium and low in sodium. And that's what we're made for. That's what our kidneys made for. Okay, so I just think this is funny. They also took these Kenyans and they took a bunch of Europeans back in 1929. And the average age of these groups was 60 years of age. Okay? And what they found was the average white guy from Europe in 1929 at the age of 60 was hypertensive, 140/90, mild hypertension. But the average black man in Kenya, age 60 years of age, had a blood pressure of like 107/65. Same as a teenager. It's not genetic. That's all BS. It's because modern blacks eat low potassium diet. They eat too much processed food and junk food. There's reality, okay? Okay, let's see, what's next? Let's talk about Richard Moore. He wrote a great book called The High Blood Pressure Solution. He talked about the concept of K-factor, the ratio of potassium to sodium. And look what he says. He says hypertension is just a symptom of eating a low K-factor diet. That means, like I just said, high sodium relative to the amount of potassium. He says, nature gives us no choice. We must have enough potassium and magnesium for our cells to work properly. Anthropologists who study different cultures are unanimous that hypertension is due to diet and lifestyle, because populations eating their ancestral diets have almost zero hypertension. They don't get hypertension. Natural ancestral diets have a high K-factor, meaning a high ratio of potassium to sodium. They don't get hypertension. And it ain't just the Kenyans, okay? It's every ancestral population that eats that way. Other examples, the Okinawans in Japan, the Yanomamo, or Yanomami you might call them, in South America in the Amazon jungle, the Tarahumara in northern Mexico, Papua New Guinea, okay? And you can also take a population like Finland in northern Europe, and you reduce the dietary sodium in their diet, increase the potassium, and they get dramatic improvements in their blood pressure. They partially substituted salt using KCl, but it was a lot more than that. They also reduced their intake of dietary fat. So let's go visit the Pima. The Pima live in Arizona these days. They used to live in what was Mexico. After the Mexican-American War of 1848, the Pima were absorbed into Arizona. They eat the SAD diet. They're fat with lots of sickness, classic stuff. Diabetes, hypertension, coronary heart disease. The Tarahumara stayed in northern Mexico in the Sierra Madre Mountains. Sierra means like a saw. That's like the up and down edge of a mountain range, like a saw. And it's Copper Canyon areas, it's also called. And they don't have problems with hypertension or coronary heart disease. They're world famous for incredible endurance. They can run 100 miles in 2 days. Nathan Pritikin patterned his diet after them. He was so in awe of their incredible physical ability. Lots of American runners, marathoners, ultramarathoners have gone out to visit them. Ruth Heidrich, the great Ruth Heidrich, triathlon champion, marathon champion, 45 plus years, survivor of breast cancer. She's still alive. She's in her 90s now. She went out and visited them as well. They're for real. Okay, there's an entire book written about them called Born to Run. It was written by, I believe it was a Christopher McDougall. It's not, not Dr. John McDougall, but another guy named McDougall. It was a good book. I read it. Okay. When they visited Tarahumara, there was no obesity. No one was fat. No coronary artery disease. Average total cholesterol 136. Average triglycerides 115. Their diet was 75% carbohydrate, 13% fat. 12% fat and 13% protein. Okay, here's a paper about the Tarahumara. This guy, Connor, studied them a lot. 523 healthy Tarahumaras, mean plasma cholesterol 125. This is just repeating what I just said. Total fat was 12% of calories. They ate a lot of corn and beans. Total plasma cholesterol, okay. They had a virtual absence of hypertension or obesity. Okay. Here's the Tarahumara. They're kind of like crazy maniacs in South America. They're always fighting with each other, and when they fight, they'll go, defeat like one of the nearby tribes in battle, and they'll kidnap the women. They're not very political correct. Imagine that. Stealing women, okay? Trafficking women. Gee, I wonder who does that. Okay, they only ate about 200 milligrams of sodium per day, incredibly low. And they'd have the same blood pressure when they were a teenager as they did in their 60s. When they checked their urine sodium, there was almost no sodium in their urine. The kidneys are great at conserving sodium. Yeah, that's what I think too. They always try to say all these primitive, noble savages. Yeah, right. They're always shooting and killing each other and kidnapping women and raping the women. Okay. Yeah, what noble savages. Okay, but at least they don't have hypertension. Okay. And that's pretty typical. These populations eating their ancestral diets. There was a dentist by the name of Weston Price. Okay, this is the dentist. Okay, he traveled all over the world in the 1920s and 1930s, and what he found was all the populations eating ancestral diets had great teeth. Their teeth were well formed. The bone was strong. They didn't have osteoporosis around their teeth. They didn't have cavities. They had a normal form jaw arch. That's called nutritional degeneration, was the name of his book. He also figured out there were other problems with conventional dentistry. I'm not going to get into all that now. We'll talk about that some other day, but that's interesting. Normal blood pressure is around 110/70, we'll say. Of course, much lower than that can be totally normal as long as you feel good, and a lot of really healthy people do. Let's see, anything else interesting about hypertension at this point? I told you about why the processed food is high. I think I'll do Windkessel effect and that other stuff in the next lecture. So anyways, I hope you found that helpful.